My name is Kathleen Lockard. I'm the only pediatrician here in Macomb, Illinois, and in the surrounding area, so I feel uniquely qualified to speak on the subject of pediatric COVID vaccine. I've been following this research very closely over the past couple of years. I have colleagues who have enrolled their kids in the studies. I wish that I could have enrolled my kids in the studies, but unfortunately there are none in Macomb, Illinois. I've found that the studies are being conducted very thoughtfully, very thoroughly, and they've enrolled thousands of kids, and it's become clear that the vaccine is very protective against severe COVID illness and hospitalization. So parents are rightfully concerned about anything new, even though most families will vaccinate their children for other diseases without hesitation. Given that this is a new illness and a new vaccine, they have concerns. So one of the questions is about myocarditis. Myocarditis is something that happens not infrequently with viral illnesses in general. It seems to happen most commonly in older, say teenage males in general, but specifically with the COVID vaccine, there is a very small risk of myocarditis associated with the vaccine. There were no cases seen in the 5 to 12 year age group in the studies so far. There have been a few cases in the older kids, but it is very clear that the risk of myocarditis associated with actual COVID infection is extremely higher than the risk with the COVID vaccine. Other parents are concerned that they need to watch and wait and be sure that there's more data available. I would say to them that unfortunately we don't have a lot of time to watch and wait and see what happens. There's so much COVID around that your child will catch COVID at some point if they're not vaccinated. It is clear from the thousands of kids that have been studied so far with COVID vaccination that it is a very safe vaccine, and my colleagues and I definitely encourage anybody 5 and up to be vaccinated against COVID. We have been vaccinated here in the office as long as we have been able to. We ask at almost every visit, have you been vaccinated? Do you want to be vaccinated? Do you have questions? I would say that the majority of my patients that are age 12 and up have been vaccinated, whether it's through a school-based vaccination drive or through the health department, through vaccine clinics here in town, or through our office. And we are very proud that we have been able to vaccinate many, many kids. And not only the kids, we've been able to vaccinate parents and grandparents and cousins and friends. And we take pride in being able to vaccinate as many people as we can to help to protect everybody here. Some parents ask if we need to separate the COVID vaccine from other routine vaccines that we give, and the answer is no. We are in the middle of flu vaccine season right now, and we are giving COVID vaccines on the same day as flu vaccines. If parents are here with a child that needs vaccines for school, we can still give the COVID vaccine. There is no need to delay vaccines or separate them out. We will also plan to vaccinate during regular office hours anybody 5 and up who wants to get the COVID vaccine. So we encourage you to call us or come in.